The introduction of DPP-4 inhibition concept, I think, was very important because it was one of the first examples for a treatment that was driven on the physiology, or actually on the pathophysiology of the disease. We have been treating type 2 diabetes for decades, from long time, with drugs that, yes, are glucose-lowering drugs, but they were drugs that have been discovered just by chance. Sulfonylureas, derivative of the sulfamides, metformin, still very much used, but derivative of biguanides, which is a derivative of the French lilac, an herb, and it was just discovered that it could reduce the glucose by chance. Now, the DPP-4 is a different example. The DPP-4 inhibition is based on the concept of the incretin and importance of the incretin in regulating glucose homeostasis. We have been realizing that GLP-1 is an important contributor in the modulation of the beta cell function as well as of the alpha cell function. In other words, restoring in a glucose-dependent manner the insulin secretion and the glucagon secretion. And what it turned out to be is that the GLP-1 secretion may be altered in the presence of hyperglycemia, early in the stage of the disease, even more in the advanced stage of the disease. And actually the GLP-1 which is secreted is very quickly degraded. So the idea was there is a defect there is something that we can address, and one way to address is to maintain the availability of the GLP-1 for a longer time into the circulation. And that can be achieved by inhibiting the enzyme which is responsible for this degradation, which is the dipeptidase 4. And a number of drugs have been developed with that concept, with that idea. And actually, a lot of studies has proven that this has a clinical implication. And because of the modulation, the concomitant modulation of insulin and glucagon, it is possible to achieve better glycemic control with a very good tolerability and safety profile. First of all, the DPP-4 inhibitors have been approved for the treatment right after the failure to metformin, which remained the first line treatment, although there is also indication for the use of DPP-4 in people with intolerance to metformin. But this is not the only condition, because there are many other conditions besides the early stage of the disease where the DPP-4 turned out to be effective, but also, which is very important, safe. And that, I would say that, any condition that has been explored so far have provided this kind of results. The DPP-4 inhibition has been tested early in the stage of the disease. It has been tested in combination with a number of other anti-hyperglycemic agents, in particular, as I already mentioned, metformin. And actually, the metformin and DPP-4 makes a sort of a very rational combination, because metformin as well may have an effect on the L cell, which is responsible for the secretion of the GLP-1. So the combination of the two may result in an even in better availability of a GLP-1, particularly after the ingestion of a meal. But it's also been analyzed and evaluated in specific conditions, in high-risk conditions. Like, for instance, in the elderly people, where the DPP-4 turned out to be a good solution, particularly for tolerability. And actually, there are examples where the DPP-4 has been used to target individualized glycemic targets to achieve better glycemic control and to reduce and to improve the risk-to-benefit ratio. There are also a lot of studies showing that DPP-4 can be used in the presence of renal insufficiency, of a loss of renal function. And again, one of the major advantages is that you do maintain a good glucose-lowering effect, while, because of the glucose related effect on the beta cell function and alpha cell, you do have a much less risk of hypoglycemia. And this is actually a very important condition, because hypoglycemia, both in people with impaired kidney function as well as in people with elderly people, can be quite an issue and can be something that we would like to prevent. There are other conditions where also the DPP-4 has been tested, for instance, in combination with insulin. And this is sort of a natural addiction, because you can improve the effect of the insulin treatment without very much increasing the risk of hypoglycemia. And there are also some data suggesting, or at least in some trial, where the rate of hypoglycemia turned out to be actually slightly lower. So it's a very flexible treatment, and this flexibility derives from efficacy, but even more in terms of the safety. So I think this provides us with a better opportunity for the treatment. But what I think is key, really I think is key, is that DPP-4, because of the efficacy, because of the neutral effect on the body weight, because of the lower risk of hypoglycemia, can be used very early on in the treatment to try to provide sustained glycemic control. And that can be achieved even to a even better extent if it is used in combination with a very common drug, which is metformin, which is the drug that is recommended to be used as a front line by all the guidelines. So the combination of the two, because they have a rational synergistic effect, because they do not increase the risk of hypoglycemia. They may favor better control of the body weight, may turn out to be quite an early advantage for the treatment of the disease. However, this needs to be verified, and by the way, there is a trial ongoing which is actually called Verify, but early combination of metformin and a DPP-4, in the specific case vildagliptin, will be tested over 5 years, which I think it's one of the major novelty and feature of the Verify trial, because it's a trial that has been designed to last at least 5 years. So we'll have better opportunity to explore how the DPP-4 inhibition in combination with metformin may provide sustained glycemic control over the years, which also may be expected to turn into better preservation of reduction of the risk of complication over the time.